stenosis. So you were made well at the factory, it just wore out. Not to worry. Now, oh, okay, we're recording. So it helps. So, well, it's good because you can play black for him and for his wife too.
And for my brothers and yeah.
Oh, good.
Yeah.
Okay.
Thank you.
So, I don't think you would be a great candidate for an open heart surgery based on a few things. Number one, excuse me, you're 87, which that alone wouldn't stop me from recommending open heart surgery for you. But when you add 87 on the fact that your heart function is weak and the right side of your heart's become a little bit lazy, and you've had previous bypass and now you have troubles with your memory, I think to do an open surgery may be a little bit too much for you. Okay. Now, I do have to, we may need to have you see a neurologist. Maybe you can do that in South Carolina to give us an assessment. And people that, you know, they rank memory loss or some of these problems with thinking as mild, moderate, or severe. I don't think you're severe. I'm not a neurologist. You're probably somewhere in the mild to moderate range.
Okay.
But it would be great if you could get a neurologist to evaluate you and give us a paper that says we think the problems are mild or moderate or severe. I think you'll say mild or moderate. Now, based on all of this, if he wants to say mild to moderate too, that's fine. But based on all of this, we'll make a decision, but we do need to do some more tests on you. And the test that we would do is we check your lung function. We would not have to repeat the heart catheterization because you've had that done, but we would have to put a small catheter in the legs in order to take a picture of all the blood vessels from your belly button down in order to see if we can put the valve in. You see?
Yeah.
Because what we can offer you potentially, maybe within a trial or maybe outside of a trial, depending on your anatomy, is that we could offer you a permanent implant that we could put in with a catheter. We still put you asleep for it, but we don't open your chest. We do everything through needle sticks in the legs, and you don't go on the heart-lung machine. We don't stop your heart. So those are some advantages. We've done patients very similar to your situation, and then, you know, the vast majority have done very well. I would say our success rate is over 95%. The chances of any complication occurring is on the order of 5% or less. That means 1 in 20 patients can develop a complication out to 30 days. The most dreaded is a complication in the legs and stroke. Of course, death is in there also. That means if we had 20 people in a room and we all did this procedure, one of them would develop some complication.
Okay.
But a lot of that will depend more specifically on your anatomy and so forth. I don't think you should wait too long, because right now your heart function is weak. If you wait any longer, it will stop on us. Most patients in your situation will not be with us in 6 months. So when I see a patient like you, I usually tell them, go ahead and start making your schedule together with my office on a day to come in to spend what we call 24-hour OBS or 23-hour OBS. You'll come in one morning, you'll stay overnight to get all the testing done, and be home the next day at noon. You'll see a heart surgeon, you'll have a CAT scan, you'll have this angiogram of your leg, you'll have lung function tests, and we'll also check the arteries up in your neck with an ultrasound. So only one invasive test, the rest will be non-invasive. And I think we could figure out what's best for you. Okie doke? Now, if you're part of a trial, we're going to ask if you can come back for follow-up, because that's important. If you're not part of a trial, we still would like to see you back in follow-up, because we feel we have more experience with this type of implant than anybody else in the Southeast. So you want us to take a look at you to make sure everything is going in the right direction. On average, we have you come back at 1 month, 6 months, 12 months, and every year thereafter. Okay? Because the trial is overseen by the government, the FDA, if you don't come back for follow-up, they come to us and they say, well, obviously, you know, Mr. Suppley, there's something wrong with him, that's why he hasn't come back. Most of the time, patients don't come back because they feel good. But the government doesn't see it that way, and we have to be careful that we get all the information so that people don't accuse us of hiding anything. So it benefits you, it benefits us, it benefits the technology and the government, and trying to make decisions on moving forward. Do you have any questions?
No, you see, without doing that, I just have 6 months.
So that's
to live.
right. And you'll get more and more tired, more and more short of breath. Your legs will get more and more swollen, and I find them swollen now. Your heart function will get weak. This is a progressive problem. So once you have the symptoms, it progresses.
Mm-hmm.
Mhm.
Okay.
And you need to, the problem is mechanical.
Mhm.
Of
You
the,
just need to get on top of it and unclog it. It's basically fancy plumbing.
Mhm.
But when your valve is stuck, we need to replace it. That'll unclog your heart. Your heart will function more. My hope's also with, if you think that your problems with memory happened in the last 6 months, it's very possible they are related to low blood flow out of the heart. Now that's not 100%. You can't say that with 100%.
yeah,
But we have seen some patients improve. Some patients don't change at all.
okay. That was one of the questions.
The other thing I would like to sort of tell you is I would take it easy on the driving.
Mhm.
Because at least the way I see your heart, it's very weak. And like I said, between now and 6 months, you're at risk. But that could happen tomorrow, that could happen a week from now, that could happen a month from now. And I don't want it happening while you're behind the wheel. Because
Okay.
then you're going to knock out a bunch of people and yourself, you know?
Yes.
So I would take it easy on the driving, and I would try and come back in the next week or two to get your workup started so that we can get you taken care of.
Okay. And of these 300 operations that you have done,
Yes.
how many fatalities do you
We've
have?
had 4 patients die on the table.
Okay.
2 of them because the valve was too big, which you
Okay.
probably won't have that problem.
Okay.
One of them because we damaged the heart on the way in, because you can do this also from the side.
Okay.
And one of them that we damaged from the leg.
Okay. And that's why you would have this.
You have to do the angiogram to
the
make sure.
angiogram to see what how his
Right.
blood vessels look like below there. Okay. And what would the recovery be if this is successful?
Average patient, if completely uncomplicated for you, will probably take 3 or 4 days in the hospital.
Okay.
If your heart function was a little bit stronger, you know, I've seen people go home in 2 days. But because
Okay.
you're kind of on the weaker side, I'm going to add a day or 2 on there.
Okay.
It's usually 1 night or 2 nights in the intensive care unit and the rest on the floor. You should not have great discomfort if we can do it from the bikini line. If we do it from the side between the ribs, you can't have soreness there. And I can't tell how we're going to put the implant into you until we look at you.
Okay. And if this were your father, you would recommend that he go to the next step of being evaluated.
I would,
Okay.
because what you're telling me is up to 6 months, he was quite good.
Yes. Uh-huh.
And so if it's just been 6 months now, if you were years and years down in a wheelchair, bedbound and so forth,
Mhm.
I would say the chances of recovering any of that function would be low.
Okay.
If you're telling me, you know, honestly you think it's within
Yeah.
6 months he's had a slide,
Uh-huh.
then that's usually something that we can reverse.
Okay.
There's no guarantees. No one has a crystal ball. If I could tell the future, I wouldn't be a doctor. I'd buy lotto tickets, you know.
Yeah.
But short of that, that's what I think.
Okay. So our next step would be to schedule a meeting with a neurologist,
Yes,
and then,
and also schedule a meeting to come down here and get worked out.
okay,
I would get them both
Thank you.
kind of simultaneously running.
okay, all right, thank you. I appreciate it very much. Dad, do you
Yeah.
have any other questions?